Hey, thanks for keeping it locked right here on Mums at the Table. I'm sitting with Dr. Simone and we're going to be talking about urinary tract infection, UTIs in children. It happens.
It happens. It's not the most common thing that happens to children, but it definitely does happen. So the things to look out for is if your child has a temperature that you can't really find another reason for. They're not snotty, they're not coughing, they're not pulling at an ear, and it's not getting better.
And does it come on suddenly, like all of a sudden they just get a temperature?
It can do, or it can be a bit of a grumbling thing that goes in the background and you go, why isn't my kid perking up? Why isn't my kid picking up from what seems to be a little bit of a bug that they've got?
Okay. 38.5?
Yeah, that's about the right temperature to be interested in.
Right.
There's a couple of groups of children that are a bit more susceptible to urinary tract infections. So any baby who has had any identified kidney or bladder abnormalities during the course of pregnancy, normally around about the 19-20 week anatomy scan, those sorts of things can get picked up then. Those children you do need to be particularly mindful of in terms of keeping a lookout for any unexplained fevers.
So important, I guess, as mums or as dads, just to remember if they have had that happen in during their pregnancy, and their child develops...
Keep it on the radar.
...temperatures later on. Keep it in the back of your mind because it could be a UTI.
Yeah, absolutely. Right. The things that we can do to, I guess, urinary tract infections are less likely if our children are really well hydrated, and so if it's been a really hot period of time or if your child hasn't been drinking as much, then that can be a little bit of a risk factor. And so being really conscious of your kids' fluid intake.
So it's not contagious, is it? It's not contagious.
Not like a cold or those sorts of things are contagious. No.
Is it anything to do with the hygiene or?
So especially that's more applicable to little girls, and especially as they get older, it's really important that we're very diligent in teaching our little girls that, you know, when you're going to the bathroom, always wipe from the front to the back, and then you discard your toilet paper and those sorts of things. So,
and even not to hold.
Absolutely.
Don't go to the toilet.
Yes, don't not go to the toilet if you need to go to the toilet, absolutely.
Right. Is there anything that we can do as parents to prevent our children from getting UTIs?
So making sure that your kids are really well hydrated, teach them the hygiene practices that are so important in terms of reducing the risk, and be vigilant. Be vigilant for watching out for the signs if there are any things that aren't settling down as you would normally expect a snotty nose or a cough or a cold to do. Then get them to the doctor and get them checked out. And
I guess a key thing is watching that temperature. If it's not going down and you're giving them Panadol or Nurofen or treating them in some way and it's still not going down,
then get it checked out.
Get it checked out.
The other thing to say with that is that if your child has 1 or 2 urinary tract infections, that's probably unlucky. But if they're having recurrent infections, if they're having them every month, or if they just don't seem to be getting over them, then that's also worth a conversation with your doctor about.
Yeah, look, such insightful information. Thank you so much, Dr. Simone. I'm sure that's helped you at home. Don't forget to keep it locked right here, Mums at the Table, and subscribe to our YouTube channel for great topics like this and more.